Applying for jobs as a new social worker can be very stressful. Heck, applying for a new job as an established social worker is stressful. This video is for anyone who's considering applying for a medical social work job, whether that be in the hospital, nursing home, home health, or maybe even hospice. Today, I'm going to give you tips on how to update your resume to increase your chances of being selected for an interview for a medical social work position. And I'm going to give you tips on how to prepare for that interview, including giving you some common interview questions. The information that I'm sharing with you today is based on my personal experience as both an interviewee and an interviewer for medical social work jobs. I can tell you that I've gotten 95% of the jobs that I have applied and interviewed for, so I'm hoping this information will be helpful for you as well. Hi, my name is Tabby, and I'm an LCSW with over 13 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and real-world experience. Maybe you are fresh out of graduate school with your MSW, ready to take on your new career in medical social work. Or maybe you're just considering changing your current social work position into something in healthcare setting. Either way, updating your resume should be your number one priority. I personally use a process that helps make sure that my resume matches what the employer is looking for to increase my chances of being selected for an interview. And I'm hoping that this process might be helpful for you too. So the first thing that I do is I look at the different job descriptions of different medical social work positions that I'm interested in applying for, because a lot of them will have similar descriptions of job responsibilities. And I also look at similar medical social work positions, like if I'm looking for a hospital social work job, I might look for many different hospital social work job positions in different hospital settings. And then I would take a look at the job description and just see what the similarities were. After looking at a few different jobs, I then make a list of the skills and responsibilities that they're looking for. To get a better picture of what some of the skills and attributes might be that they're looking for in a medical social work job, make sure to check out my video on the 9 core skills you need to be a medical social worker. And then you can also base your list of the skills and attributes based off of that video. After you make a list of the different attributes, skills, and general responsibilities from the job descriptions, start taking a look at your resume. Can you think about any of your previous jobs, or maybe even your current job, where you have had duties that align with some of the skills that you wrote down? If you've ever worked in customer service, I guarantee that you have many of the skills needed for a medical social work job. Next, I would change the wording so that way it matches some of the skills or things that are listed in the job description. I often make multiple versions of my resume so that way it's highlighting different skills and responsibilities that match different job descriptions. In my professional experience, there seem to be 2 common types of interviews in the healthcare setting. One of them is called behavioral interviewing and the other is called situational interviewing. And you might run into either of these, or maybe even a combination of these types of interview when you are interviewing for a medical social work position. Behavioral interviewing is when interviewers are asking you about your actual experiences in your work history, because it's a good indicator of the type of worker you're going to be in their setting. In these interviews, they are looking for answers that involve a very specific situation. So when you are providing an answer, they're looking for a story. So your answer needs to have a beginning, a middle, and an end. They want to know about a specific situation. They want to know what you did, what the action was that you took, and they want to know what the result was. This is known as the STAR method. STAR stands for situation, task, action, and result. So for the situation, you're going to want to describe what the situation was and give detail about the situation. Try to make the person understand what was happening and what was going on at that time. And then the task is explaining what the task or what the goal was that you were trying to accomplish. For action, you want to describe what actions you took to address the situation. It's important for you to focus on you and describe what you specifically did or what contributions that you made in those actions for that situation. I know as social workers that can be very uncomfortable, but you've got to learn and practice how to do that. And then for the result, you're going to want to describe what the outcome was for the actions that you took to address the situation. Talk about what happened, what was accomplished or wasn't accomplished. Was it successful or unsuccessful, and why? Talk about some of the positives and negatives. If the result was not a desired outcome, talk about maybe what you learned from the experience and maybe what you probably would have done a little bit differently. Employers are going to want to know how you handled the situation and whether or not it was effective for a positive result. They also want to know that you're adaptable, that you can learn from your mistakes and other experiences. The other style is situational interviewing. In situational interviewing, the interviewer is going to give you a hypothetical situation, and they want to know how you would handle the situation, not necessarily how you have or if you've had previous experiences with that specific situation. However, you can draw from previous experiences if it's relatable and if it influences how you would actually handle the situation. To prepare for either interview styles, you might want to make a list and write down the different situations and experiences that you've had in the past that highlight some of the different skills that is listed in the job description. Okay, it's time for common interview questions. So the questions I'm going to go over are both behavioral and situational. So I'm going to give you a good idea of what you can expect from either interview style. Also, these questions are ones that I've actually been asked myself at being an interviewee, and some of them are also questions that I have also asked as an interviewer. Okay, let's start with some of the behavioral interview questions. So some of them that you might expect to have are going to be, describe a time when you received negative feedback and turned it into something positive. Or describe a situation in which you encountered an interpersonal conflict with a peer, and how was it resolved? That one gets asked a lot in a lot of interviews that I've experienced. Give an example of a time when you had to deal with an angry customer. What was the problem and what was the outcome? What was your role in diffusing the situation? Describe a time when you were faced with a stressful situation that demonstrated your coping skills. Can you describe a situation where you had to prioritize tasks with limited time and resources, and how did you handle it? Describe a situation where you felt you had not communicated well. How did you correct the situation? For an example of a question that's going to be very hypothetical and with a very specific situation, let's take a look at this one. Describe how you manage the following. At the time of the planned discharge, the doctor decides to keep the patient longer because the patient experienced a tachycardic episode. You spent a significant amount of time getting everything arranged for a patient to discharge to a skilled nursing facility, including getting insurance authorization and setting up transportation. How would you handle this delay in discharge?
Okay, so as an example for this particular question, this is how I would answer it. First, I'm going to identify what skills they might be looking for. In this instance, what I'm hearing is that they're looking for my ability to adapt, my ability to reprioritize, and my ability to communicate. So the first thing that I'm going to do in this scenario is I'm going to verify that the patient really can't discharge. So I'm going to ask the doctor and verify that they cannot discharge and get an idea of maybe when they can discharge. Then I'm going to contact the skilled nursing facility coordinator, and I'm going to communicate the discharge changes, and we're going to potentially come up with a new discharge date and time. Next, we're going to make sure that it is still within the insurance approval. The thing with insurance is that usually they're only going to approve that the patient go to a skilled nursing facility within 48 hours of their approval. So if we anticipate that the patient's going to need to be there longer than 48 hours, then we're going to go ahead and prep and request to get updated physical therapy and occupational therapy notes so that we can prepare to give that to the insurance company to get pre-approval in time for the new discharge date and plan. Next, I'm going to make sure that I rearrange transportation. And lastly, I'm definitely going to communicate all the discharge plan changes with my interdisciplinary team, the patient, and of course the family. And that's how I would answer that particular question. But you might answer it a different way based on your personal experience or professional experience. It just kind of depends. So hopefully that gives you an idea of what a situational interview question might be.
To help you prepare for your interviews, I'm giving you free access to a medical social work interview preparation worksheet and a list of common interview questions to consider. I'll have it linked in the description box below. I hope this gives you an idea of how to prepare for interviews for a medical social work job. I know you're going to rock those interviews as long as you prepare and have confidence in yourself. If you like this video, please like, subscribe, and share with others. And keep the feedback coming. I love to hear about the different content that you're interested in so I can share my expertise with you. Also, make sure that you sign up for the Medical Social Work Mastery newsletter, where I send you tips, tricks, and resources on how to become a more efficient medical social worker. You guys are so awesome, and thanks for including me on your social work journey.